If you're a basketball player, chances are probably high that you've dealt with jumper's knee at some point in your career. It's a very annoying injury and can also be a very debilitating injury. So today we're going to talk about what jumper's knee is and what we can do to fix it. Before talking about how we can heal jumper's knee, we want to understand what it is. And what jumper's knee is it's pain and inflammation right in your patellar tendon, which is right underneath your kneecap. A lot of athletes who go through repeated jumping suffer from this condition, and that's where we get the term jumper's knee. Now the problem with this condition is it can be a very vicious cycle, because what happens when we get the inflammation in that tendon, it sends signals to our brain to essentially shut off the muscles around that tendon. It's our body's way of trying to shut down the area so it doesn't move as much, and that's how the body and brain think that that area can heal. Now the problem is when those muscles turn off, it essentially makes that overworked patella work even harder. So we can see that vicious cycle that as these muscles shut down, this area that's already overstressed has to work harder and harder, and the pain can just keep getting worse, and we can get very frustrated that we're not recovering to our fullest extent. So what we want to do is we want to focus on the muscles around the knee, reactivating those muscles and make sure that they're working to their fullest extent. Our first exercise to aid in our recovery from jumper's knee is what's called a quad set. To perform this exercise, I'm going to take a rolled up towel or t-shirt like I have here. I'm going to place that towel or t-shirt right underneath my knee, and all I'm going to do is I'm going to squeeze my quad muscles to try and push my knee down into that towel or t-shirt. Really focusing on getting a good contraction, and I'm going to hold that contraction for 5 seconds. I'm going to release that contraction, and I'm going to repeat for 10 repetitions. Now, the reason that this exercise is really good is we're getting an isometric contraction of our quad muscles. Now, when we get an isometric contraction, we're working on a few different things. We're teaching the muscles how to recruit more muscle fibers, how to recruit those muscle fibers faster, and we're also working on muscular endurance of that muscle. And the other big benefit for isometrics, especially in a rehab type of setting, is we don't get any joint movement while we do an isometric contraction. We get muscle firing and muscle activation, so that's good. We want that. We want those muscles reactivated to take pressure off of that patellar tendon. But we also, early on, don't want to move that knee too much and really overstretch that tendon, just causing us more pain. So during that isometric contraction, we're not really getting any knee movement that will cause pain in that patellar tendon. So we're getting the benefits of firing and activating our muscles, but we're not getting the cons of aggravating that patellar tendon. Our second exercise that aids in our recovery from jumper's knee is what's called a single leg terminal knee extension. To perform this exercise, you'll want to take a long resistance band like I have here, anchor it to something nice and sturdy, a dumbbell rack, a squat rack. If you can securely anchor it to a door at home, that's fine as well. I'm going to take my leg with my affected knee, I'm going to put it inside of that band and place that band right at the back of my knee. I'm going to back up a little bit so I have some tension on the band, and essentially I'm performing single leg quarter squats. I'm going to keep all of my weight on that leg that's inside of the band. As I go down into that quarter squat, my free leg kicks out to the side and toe taps lightly on the ground for balance. And the key to this exercise, when I come back up to standing, I want to squeeze my quad muscles and really push the back of my knee into that band. I hold for a second or two, and then I repeat. I'm going to perform 12 to 15 repetitions of this exercise, 2 to 3 sets of this exercise, resting about 30 to 45 seconds in between each set, just making sure that the muscles are fully recovered before we move on. Now the reason that I really like this exercise for recovery from jumper's knee versus a goblet squat or a back squat is a couple reasons. Number one, similar to our quad set, we're not getting a whole lot of joint movement, so we're not going to be doing movements that really aggravate that patellar tendon. Number two is the angle of the resistance. If you looked at a goblet squat or a back squat, based on where I'm holding the weight, when I come up and I get to that full terminal knee extension, my muscles really don't have to work as hard. I can cheat and essentially just rest on my joints because that angle of resistance is going directly vertically down through my body. So I can just rely basically on my anatomy to hold that weight up and not my muscles actually firing. Now, for our recovery from jumper's knee, we want to get those muscles firing. And that's what we get with the horizontal band. When I come to that full terminal knee extension, I'm actually getting the most muscle contraction because that's when I have the most tension on that band, and that's what we really want. We're really focusing particularly on that VMO muscle, which is that teardrop shaped muscle on the inside part of the knee. That's really important for knee health. A lot of people have deficiencies in that muscle because, again, during the goblet squat or the back squat, we're not getting that full VMO contraction at the top. So performing this exercise is a really good way to ensure that that muscle is firing to its fullest capability. Performing these two exercises 2 to 3 times a week is a really good way to begin our recovery from jumper's knee. Don't be frustrated if you don't feel relief right away. Some people recover quicker than others, but if you stay consistent with these exercises, then you'll start to feel better on the basketball court, healthier on the basketball court, which will make you feel like you're a more confident basketball player.